Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha from Roots Community Health Center, reporting for the week of November 8th, 2021. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we are here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. The United States, in terms of COVID cases, is now plateauing, and the concern here is that it is plateauing at a rather high case rate. So we, of course, would love to see it continue to come down rather than level off. We know that some states are seeing increases, others are plateauing or decreasing, but on balance, we see that for the United States, we are plateauing a little sooner than we would like to see. So we are going to be keeping a close eye on this to see what the trend will be. When we look worldwide, unfortunately, cases are actually increasing worldwide, and we are already starting from a relatively high case rate. So it's important for us to remember where we are globally and nationally, because we know that so far this pandemic has occurred in waves, and we are, of course, concerned that we will be seeing a wintertime surge. So it definitely behooves us to be looking around at what is going on outside of our immediate area. And unfortunately, when we get to California, we see that daily cases are actually ticking up over the last couple of weeks. So this is certainly not what we want to see. We don't want to see cases going in the wrong direction, particularly as we begin to head into the colder weather and head into the holidays, where if it's anything like last year, we're going to be anticipating folks traveling, more mixing, there's more opportunities for more spread. And so this is certainly not the direction we want to see things happening here in the state of California. Alameda County now has 120,002 documented coronavirus cases. This is up about 1,000 more than when I reported a week ago. There have also been 1,457 individuals who have lost their lives to COVID-19 here in Alameda County, and this is up 25 more than when I reported a week ago. And in terms of vaccination, we are creeping along pretty slowly here. About 85% are fully vaccinated for the county of Alameda, and city of Oakland is just behind at 83.1%. And remember, this is of those 12 and up, and still seeing big disparities. So while the county on average is at about 85% fully vaccinated, for African Americans, that rate is only 66.8. That is a huge disparity. And unfortunately, it is not the only disparity. We also have death disparity, and that is a disparity that, because of this vaccination disparity, the death disparity continues to widen. And if we can't close the vaccination gap, unfortunately, we anticipate the death disparity will continue to widen. And specifically, what I mean by that is when we look per 100,000 residents in Alameda County, African Americans' death rate is 161 per 100,000, and for whites it's 75 per 100,000. So that is more than double, and we want to see that disparity narrow rather than widen. But because there's such a big vaccination disparity, and we know that the vast majority of deaths that are occurring are in unvaccinated people, we are simply bracing ourselves for that disparity to continue to widen. And when we look at cases in Alameda County over the last 14 days, you can also see this plateau here that is plateauing, a little bit higher. We'd like to just see it come all the way down to zero, but we seem to be plateauing there, and hopefully we won't be seeing it going in the other direction. Now, unfortunately, when we look at these two age groups here, 5 to 11 and 15 to 17, these are the two age groups where we noted an increase in cases over the last couple of weeks. And you can go on the county's dashboard and look at all these different age groups if you like, but these are the two where we are seeing cases uptick. And this is certainly unfortunate, because we now have a vaccine for all of these age groups. and the 5 to 11-year-olds being the vaccine that was the most recently approved. And we've had the 12 and up for some time now. And so I will just say that if these babies are being exposed to COVID-19, then really they should be vaccinated. If for whatever reason they're not going to be vaccinated or they're not vaccinated now, please let's stop letting them get exposed. So, really, if they're out there and they are in school, they are going out, they should certainly be masking, but they are also now eligible for the vaccine. So, if they are at risk, if they are exposed, then we'll want you to please look into the vaccination. It is going to be being offered really everywhere as of this week, certainly. And so we want you to take a look at the information, get all of your questions answered, but certainly do not put our children in harm's way, because now we have what is essentially a vaccine preventable illness, and certainly severe illness and death is certainly preventable by the vaccine. And last week I went into the 5 to 11-year-old vaccine in a lot of detail. So if you're interested, please take a look at that. So overall, not great news about the where the pandemic is right now. But certainly we are not yet seeing increases in hospitalizations and deaths. That is partly because it lags behind increases in cases, but also because the vaccine is protective. So now we are primarily mostly worried about those who are unvaccinated or those whose immunity may be wearing off. And we know that boosters were approved. And so for those whose vaccines were some time ago, the booster is certainly a consideration. And we've also gone over that in a lot of detail, but definitely 65 and up should be getting a booster if you're more than 6 months out. And those with underlying conditions, particularly those 50 and up with underlying conditions who are more than 6 months out, should be getting a boost. Everyone who got the J&J more than 2 months ago should be getting a booster. And again, we went over that in great detail 2 weeks ago. Now, for some hopeful news. So, there's finally an oral outpatient COVID treatment on the way. It was already approved in the United Kingdom last week. And like all antivirals, you really need to start it early for it to be effective. So you've got to take it within 5 days of symptoms. And it was shown to reduce hospitalization by 50%. So this is very significant. As I reported many times, right now, the only outpatient treatment that we have available is monoclonal antibody treatment. It is absolutely saving lives, but it is an infusion treatment. And so while we definitely want people to get that treatment, we know that once the oral is available, that is going to be much more accessible for a lot of people and much more convenient. And so we are certainly looking forward to that. The drug will be reviewed by the FDA's advisory committee on November 30th. So it could actually be available as soon as December. And so that drug was produced by Merck, and it is called Molnupiravir. Hope I got that right. But that one is on the horizon. And we've also got very impressive interim results of another oral COVID-19 treatment by Pfizer. And that is showing reduction in death and hospitalization by 89%. So that is pretty amazing. And they actually had to stop the trial early because when you have such overwhelming success early, it becomes essentially unethical to withhold the treatment. So you don't want to give any more placebos. They've shown their effectiveness. They are submitting this data to the FDA, they've said, by November 25th. So we are certainly hopeful that before the end of the year, this one will be approved and hopefully be available soon as well. Now, with both of these oral treatments, just like monoclonal antibody treatment, the key is that you've got to get diagnosed early because you've got to take it early in order for it to be effective. So, timely testing is absolutely critical. And so remember, we have a couple of tests that we can do. We've got the PCR test, which is the gold standard. And this is the one where you do need to go into a medical facility. And then we've got the antigen tests, which are the rapid ones, not quite as accurate. However, they are very convenient, and they can help you with your decision making, both about whether you should be going to seek treatment, but also perhaps about what activities you will be doing. And so we really think it is important that, particularly with these treatments coming up, but also with the holidays coming up, that we get comfortable with the different ways of getting tested and that we be strategic about how we are using them. So we know that the PCR is the gold standard. We can rely on it better, but you do need to get it at a medical location and usually wait up to 48 hours. Now, the rapid antigen tests do not amplify the virus, so they can only detect it when you have a lot of it in the nose. But usually that is what happens when you are contagious. So this test is likely to be positive when you are most contagious. So if you do a rapid test and it's positive, believe it. Now, unfortunately, it can be negative when you're in the earlier or later days of your contagious period. So you're less contagious, but still, we don't want it to give you any false sense of security. But it is a potential first layer kind of a tool that can be useful in helping you make decisions. So, for example, if you are going to be visiting someone, then you can actually do this antigen test right before you go in the door. And it can let you know if you are contagious. Again, it's not perfect, but it can be a layer of protection. And I think, especially in light of the fact that treatments are becoming more available soon, the other really important use for a test like this is that the sooner you know that you're positive, then you can take the steps you need to take in order to get treatment. So if the antigen test is positive, believe it. You may then need to get PCR confirmation, so that you can get these treatments, for example, or just to be 100% sure. Or you can repeat the antigen test every day, every 2 days, every time you're going to be interacting with other people. And definitely, if it's positive, believe it. And if it's negative, again, you may need to do more, like get a PCR or repeat the antigen test. It really depends on the situation. I went over this actually in a lot of detail on October 19th in the October 19th briefing. So if you are interested, check it out. But right now, I'm really feeling like every household should probably have these tests on hand. The White House has said that they have invested billions of dollars and they will be available soon. Right now, they are a little pricey at the drugstore, but let's please keep an eye out for where you can get a hold of these, as that investment hopefully hits the streets. If you are unvaccinated, for sure, you should have these in your home. Every unvaccinated person should have access to these tests, and also know your nearest testing site, because in the event that you get symptoms, you get exposed, you absolutely want to make that diagnosis as soon as possible so you can act accordingly. You can use these right before a visit with someone who is potentially vulnerable. But also, if and when you come down with symptoms, you're going to want to do this right away and before you expose yourself to anybody else. So, again, it's especially important to get tested timely, and that is so that you can get potentially treated, but also so that you can isolate yourself and not spread it to others. So, at this particular point that we are at in the pandemic, what I think is the most important thing to be thinking about is that, first of all, we don't want any false sense of security by the cases coming down. We've been here before. Let's please not fall for it again. COVID has pretty much been in charge this entire time and has stayed a step ahead of us. And it is really up to us to learn from the past, learn from our mistakes, learn from other countries, what's going on in other parts of the world, and really double down. So now is actually the time to take some actions that hopefully can keep us from experiencing too severe of a wintertime surge. And what that includes, first and foremost, is vaccinating the remaining unvaccinated. So those are the folks we are most concerned about. They are 10 to 20 times more likely to catch it. more likely to go to the hospital, more likely to die. That's who we're worried about. So we're going to want to vaccinate the unvaccinated. We also do want to boost those that have maybe waning immunity that got vaccinated a while ago, or maybe they didn't mount the best response in the first place. So we're going to want those folks to be boosted. Then, when it comes to our activities, we are going to want to continue to embrace outdoor activities. So, if that's your outdoor heater, your tents, your covers, whatever you need to do outdoors is always going to be the safest, especially if you are mixing with different bubbles or different pods. Outdoor activities are going to be by far the safest. And when indoors, we need to make indoors safer. And we really need to be turning our attention to all of our indoor spaces, whether those are our offices, our schools, or also wherever we may be wanting to gather. And so making indoors safer has everything to do with who is coming in. Are they vaccinated? Are they infected? Did they get tested? Do we know who they are? But it also has to do with good ventilation, opening windows or doors when you can, having the HVAC on with appropriate filters, a MERV 13 or higher HEPA filters. All of those will make the indoors safer. And if you have a carbon dioxide monitor, that is a good proxy for ventilation as well. And that is something that you may want to consider adding to your repertoire. Test strategically, I just reviewed, and basically, you want to test at the right time. That will keep you from getting others sick, and it will also enable you to seek treatment in a timely manner. And if you test positive, you're going to want to isolate right away, treat timely, and contact trace. I really want to emphasize that if we are getting together with others, especially in an indoor setting, but really even in a backyard gathering or anything like that, keep a guest list and have updated contact information. Nobody likes to make those phone calls, but it is very important that we make those phone calls. It can save a life. So make sure you have a guest list for any occasion that you are hosting or any occasion that you are attending. You can politely request that that be something that is done because it is a best practice. We are still in an evolving pandemic, and we would all be wise to prepare for a potential wintertime surge. And remember, to optimize your immune functioning, take a multivitamin supplement, consider additional vitamin D supplementation, manage your stress, and get a good night's sleep. This concludes today's People's Health Briefing. Thank you for joining us. Please tune in next Tuesday at 10. See you then.